screen, yeah.
Perfect. All right, welcome. Tonight we're going to go over GLPs, microdosing, how to be successful. Most of you know me, but for anyone that doesn't, my name is Holly. I'm a functional wellness practitioner. I'm going to speak primarily to women. Like 99% of the people that registered were women, but most of the things will apply to men too. It's a little easier for them, although if they watch this recording, that might upset them. But hormones are impacted either way. It's a little bit different how it does it, but most of the information will cross over. Okay. Um, they're everywhere right now. You basically we're seeing it. If you're like me, you're seeing it in your Facebook feed, you're seeing it in your Instagram, your friends are talking about it. We're hearing Ozempic a lot. And 1 in 8 women and men right now in America have tried a GLP. So they're everywhere. The good news is we also saw last year the first time ever the obesity rate in the United States went down. And I would love to say that's because of all the great nutritionists and personal trainers, but it is the implementation of these tools. They are great tools. They're changing weight loss, they're changing health for the better. But there are a lot of things to know with them and a lot of things that can make them go successfully or make it maybe end up worse in the long run. And my hope tonight is to kind of go over all of that with you. All the information out there, the main types of them, and how to use them to get the best effect for you. Which is really the question I get every day. Somebody says, "Oh, should I do a GLP? Or is that right for me? Is that right for women? What do you think about it?" Or I hear it brought up every day. I want to start with saying it's a tool, but it's not a shortcut. I think there's a lot of almost shaming going on with GLPs. I myself, a few years ago when they first came out, really looked at it as going, oh, that's the quick fix. And we really know now it's a tool. It's not a quick fix. There's no need to shame around them. There's no need to feel uncomfortable about it. I use the analogy of digging a hole. If you're digging a hole for your garden, sure, you can do it with your hands, but it's a lot easier with a shovel, right? So that's how I kind of want you to think about GLPs. I want you to think of them as a tool. They are not necessary, but they are extremely helpful. And there's lots of variations for them. But this whole mindset of it's the easy way out, especially with the newer GLPs, is just not true. And that is something we're seeing a lot. The tide is kind of turning, they're becoming more mainstream. But I put the best study we have right here, the Surmount study. We saw that 97 to 98% of women on it hit at least 5% of their weight loss. 29 to 30% of people did it on their own. So, of women trying to lose weight, tracking their food, eating well, exercising, you can see that 3 times more people lost weight. And I think that's a really impactful number for women, especially women over the age of 35. You know how difficult it can be to even just maintain your weight. And so when we talk about something like this, it's helping. It's not doing the work for you. It's kind of removing those barriers that are making it so hard to lose weight. This is kind of an overview of what we're going over tonight. We're going over the 3 main types, Ozempic, tirzepatide, retatrutide. We're going to talk about what I think is the thing that's most important about them and what I don't see being discussed at all. Kind of the foundational framework that you should use with them, what I do personally, but what you should be doing when you're on them. And then any extra questions you have. I had maybe 10 or so questions submitted. If you did submit a question, they are woven in within the presentation. But if you want that answer directly, you can also ask at the end, and I will be emailing them out directly as well. Okay. First, the biology. What is a GLP? GLP stands for glucagon-like peptide. They are already in your body. It is something your body already makes. It's in your gut after you eat. This is something that mimics it. All peptides work like this. They are something that your body was already manufacturing. Also, we know now genetically, when we've rolled out genetic testing and looked at that, we know genetically some people just make less. And that's a really important thing to understand, especially when we just talked about the like shame, easy way out mentality you hear sometimes. We accept that some people make less thyroid. We accept that some people have kidney issues from birth. We, for some reason, don't accept that some people don't make as much GLP. We don't accept that, and we didn't until very recently, accept that for some people, they could eat the same, exercise the same, and they don't lose weight. And for women, that is even more true. And for adults, men included, over the age of 35 or 40, those things are true. Our hormones are declining. So what worked at the age of 20 doesn't now, partially because of hormones, but partially because we are manufacturing less GLP, which I think is something else to know. That we're not just adding a pharmaceutical type medication, we're actually mimicking something our body used to make more of, or something that other people make more of that maybe we don't. There are actually three different receptors, if you will, in this space. You have GLP-1, that's the one that Ozempic, Wegovy, and I will go over all three of them separately. That one really works on appetite and how fast your body digests food. Then we have GIP, also something that you make, that works on your blood sugar and the release of insulin and helps support that and the way you burn fat. Glucagon is the third. That is what is added into Retta. That increases the energy that you're using and also helps the way that your liver processes body fat. And that's the newest. First, we'll talk about Ozempic and Wegovy. This is also called semaglutide. It is just GLP-1. It is the only one that's come out so far on a pill. And in the studies, the clinical trials on that, people lost about 15% of their body weight. The time frame of the studies isn't apples to apples. Some of them are studies are 12 months, some are 15 months, some are 16 months. But overall, if you're looking at about a year when people are on them, on Ozempic and Wegovy, it's about 15% weight loss. These are kind of a breakdown of positives and negatives. Ozempic and Wegovy has been around for the longest time. I do want to say that all of them have been around for a long time. We've just started hearing about it, but most of these have been around for a long time. We have quite a bit of data on them. Even Retta, Retta's been around in the bodybuilding world for years and years and years. They're not new. It's just that they're gaining popularity as we're seeing these studies come out. Ozempic and Wegovy, though, is what you think of because it was the first one to become really popular. It's really helpful in turning off your hunger cues. People are not hungry when they're on Ozempic and Wegovy, which is its primary reason that it loses weight. Also, people tend to have GI side effects. So, like, to kind of make it really simple, people essentially aren't hungry or they're too nauseous to eat. It doesn't mean that I am not a fan of it at all, but for me personally, I tend to lean towards the newer ones. But there still is a place for Ozempic and Wegovy. It's less expensive. You can get insurance to cover it a little bit easier. It has the cardiovascular benefits just like the other two, and it's available in a pill. A pill form of tirzepatide is on the horizon, but for right now, for a pill, this is the only one we have. It has the same side effects. Actually, the side effects here are a little bit worse with Ozempic and Wegovy. Usually, if somebody had a lot of nausea, they were on Ozempic and Wegovy. It only works on that one pathway, so there's no GIP. It has similar GI and muscle considerations. So by that I mean that if you're not eating, you will lose weight. And so that's why we're seeing what's called Ozempic face, Ozempic butt. And that is from people not eating enough. And that tends to happen mostly on Ozempic and Wegovy because we use it at higher doses. It's used usually at a higher dose, and that higher dose makes people really not eat. Thyroid contraindications are true of all three of them. If you have a history of thyroid cancer, it's not a great idea, or you do want to be checked by your physician for control of that and be in full remission. Next is tirzepatide, also known as Mounjaro and Zepbound. This was originally created for people with diabetes, but also for weight loss. It adds the GIP. It is also FDA approved, and the studies of this showed more weight loss, 20 to 20% body weight. As I said, this is my go-to for most people. That's my recommendation because it adds the help of Ozempic Wegovy. You do get a little bit of a blunted sort of appetite cue. I wanted to say back up, I skipped over for Ozempic. I do think for people who are compulsive eaters, a lot of times they go to Ozempic first. If their primary concern is someone that is like really, really can't manage their compulsivity around eating, Ozempic and Wegovy can be really helpful. I personally think they probably need to be paired with therapy rather than just being put on that. But there is an application for that one. Otherwise, tirzepatide tends to be the one that I lean to recommending more because it helps with the processing of blood sugar. In perimenopause and as we age, blood sugar regulation can be very difficult. Tirzepatide helps with that more. It also helps reduce inflammation. So
Oh, I smell fish.
that's also where we
Is
see
that fish?
Are you taking a video?
microdosing.
No, I'm not. I'm listening to a podcast.
I might mute you.
Nothing.
Am I muting?
What smell?
Sorry.
Oh, bad.
Nah, I thought it was fish. That's all.
Let's see. It also helps lower cholesterol. We've seen data with people. I can actually know someone in particular who was eating excellent, exercising, doing everything right, had genetically high cholesterol her entire life, went on to tirzepatide and had a normal cholesterol for the first time ever. So when we talk about medications like, your statins, things like that, that lower cholesterol, they have pretty robust side effects. There can be joint pain, lots of things long term with the statins. So now we're kind of seeing that with the GLPs, we're able to lower cholesterol in a way that doesn't give them quite those same side effects. Microdosing for autoimmune conditions, things like mast cell activation syndrome, that's that MCAS, and psoriasis, people that are experiencing a lot of benefits with that. There's some data behind long COVID, other immune symptoms that come from inflammation. It is FDA approved. Lower side effects typically than Ozempic. People are a little bit less nauseous. People are still a little bit hungrier on this one, which actually I think is a benefit. When we talk into the side effects of weight loss, or muscle loss rather, being able to still be hungry is actually a benefit, because we don't want you eating nothing. All of them are going to have this potential for rebounding after. We will talk about that with side effects, but that's true with all three of them. And then we have Retta. Retta also adds glucagon. The body weight studies were higher in Retta. It is in the final stages of FDA approval, the final clinical trials. We have a lot of clinical trials that have gone through. So it is available from FDA pharmacies, but doesn't have full FDA clearance. It doesn't have a name brand yet. It will probably mid to end of this year is what we're hearing. It doesn't have a name brand yet. It does go by Retta, but it doesn't have a name brand. The studies show the most amount of weight loss with Retta. Not by much over tirzepatide, but an additional 3 to 5% weight loss. The joint pain is one that we see. I've heard people tell me that they feel less joint pain on tirzepatide, but when we look at clinical trials, retatrutide was tested specifically for that. 60 to 70% of people saw a reduction in their joint pain. So pretty significant joint pain reduction there. Part of that could be because of weight loss. So as we see weight loss, obviously, as people lose weight, they lose pressure on their knees. So sometimes you see pain reduction because of that. They're not really sure how much of it is caused directly by the Retta versus the weight loss, but clinical trials did show a reduction in pain. Also, the reduction in cholesterol, specifically bad cholesterol with Retta and tirzepatide as well. The triple action allows people to burn fat. Specifically, if you have a liver, like fatty liver, or liver enzymes are elevated, retatrutide could be something that maybe would be really beneficial for you. It is really growing in popularity. A lot of people lean to Retta as being kind of the next big thing. The data is amazing. There's been some data around long-term tumors where they showed a reduction in tumors in mice. And that actually remained reduced both in number and in size after discontinuing Retta. So it's doing a lot of things on the back end that are pretty impressive. Also, you can lose weight while still eating carbs. Retta is designed to work on oxidation of fat as well. And so people lose weight while still on carbs, which is why you hear people say you can maintain muscle. Retta is great for maintaining muscle. And the action there is because people can eat more and still lose weight. So that allows them to strength train and maintain muscle in a way that they don't typically do in tirzepatide and semaglutide. I will say something I noticed with people that I worked with Retta is that occasionally it can make people feel a little bit anxious. So that is my only caveat. People are always like, do you recommend Retta? Is Retta the next thing? It is. The data behind it is quite amazing and impressive, is doing a lot of great things. For example, I could think of a woman and her husband, they both went on Retta, and he saw an improvement in his testosterone in his 50s. from 200 to numbers in the high 500s in the course of a year without testosterone therapy, which is really impressive. Testosterone therapy can be wonderful for men, but it can also have some side effects. So Retta is doing a lot of great things that we're not seeing with the other GLPs. However, sometimes it does cause a little bit of an elevated heart rate, and some people can have that cause them to feel like a little bit anxious right in the beginning. So it's super important to come in low and slow and work with someone if you are working with Retta. Retta is also one that we see a lot used in quote the gray market. I am not a big fan of gray market peptides. Gray market means that you're mixing them yourselves. They're coming from research grade. Because retatrutide is new, you're seeing a lot of people who are using Retta are using it of a research grade. When you're getting a research grade product, you don't know if that dosage is appropriate. You don't know what else is in it. There can be a lot of impurities. I'm not a fan. We only use Retta from an FDA certified pharmacy. So those are kind of the two biggest downsides to Retta. Either way, the other considerations are the same. You can drop weight too fast. You can have GI upset. Another big thing with Retta is it's very powerful. So occasionally you'll see people that, if they're ordering research grade on their own, I could think of somebody in specific who reached out to me, ordered research grade on their own, decided, hey, I really want to lose weight by the summer. Let me get the highest dose I can possibly get, and ended up with like the worst stomach flu you could ever think of. So because it's a little bit stronger, you do need to really work with someone that understands how to bring you in at a lower dose, and with someone that really understands how to work with it, especially as women, because we're kind of predisposed to anxiety. But that being said, I have several women on it right now. None of them are experiencing anxiety. So it's very specific person to person. And I think it really depends on what you're eating and drinking around that. I can't see the chat, so I don't know if anyone had any questions. I'm kind of going fast, but I will also allow questions at the end, of course. I tend to run over, so if I'm talking really fast, it's just because if you've ever been on any of my webinars, I tend to like run way over. So I'm trying to get through everything because I know people have questions. Microdosing. We see microdosing with tirzepatide and retatrutide. It's not really something you see with Ozempic, but you do see it with the other two. And that's because of that inflammation control. We're able to get both weight loss and inflammation and sort of that pain management. I don't want to say pain management, but that reduction in pain symptoms at a very low dose. And so at a dose where people don't really know that they're on it, it's not really affecting them in terms of nausea or stomach, GI upsets. But what they are seeing is a drop in inflammation, especially if someone has an autoimmune condition or if they're generally inflamed, which most of America, we are just like metabolically messed up, right? We have all these things going on in the background. There's chemicals in our food and our water and everything. We're really stressed out. And so for a lot of adults, middle-aged people living this life right now, they're inflamed. And so they take a really small dose of these. Sometimes they'll take it every 10 days, like half of a starting dose, sometimes even a quarter dose. It's also a good starting place for people who have never started a GLP. And so they're concerned, they want to come in low with it. I've seen a lot of great success in my ladies with perimenopause going on a micro dose of it and losing that last 10 pounds that they can't seem to lose for the life of them. So that's where we really want to think of GLP as that tool. Because for women who've been trying, I've been working with women in perimenopause for 8 or 9 years. And so I have watched women personally very up close do everything right over and over and over and over, and it just not work. It just does not work the way that it should. And there's a lot of data behind that and a lot more I could dive into about it, but that's where this microdosing for a lot of people is really life-changing. I saw, all right, two things in the chat. For your appendix, you have to work with the clinician. So we do let them know appendix is something that they take into account, and sometimes they will approve the GLP fully, and sometimes they will want you to do things differently, and that just depends on what else is going on in your body. It's a possibility to gain back muscle. To gain back muscle while on it in menopause. Yes, it is possible. The thing is, you need to be able to eat enough. And so that's where if you're not eating enough, you're not going to gain muscle. So it's not that it's not possible. It's just that it makes you eat a little bit less. And if you're in a calorie deficit, you won't usually gain muscle. I have seen people gain muscle on retatrutide. I have seen people gain muscle on tirzepatide. I have clients right now that I'm working with via DEXA scan who have lost 30, 40 pounds on tirzepatide and have seen muscle go up. That being said, they are actively working to strength train and they are actively monitoring their protein intake. So it can absolutely happen. Sometimes we pair it with growth hormone peptides. I'm doing a full thing on peptides the next month. I just made the chat so big, so now I can't see the slide. Ah, I need like a second person that comes with me and does this stuff. I hope that answered that. I'm going to go more into muscle when I go into side effects. But yes, it is possible. Not easy. It's not easy to gain muscle as a woman either way. And sometimes you can use other peptides if you really need to help gain back muscle. There are other options. So just because I think GLPs are a great tool doesn't mean that they're the only tool. They're super personal. Not everyone wants to go on a GLP. I respect that. Not everyone is interested in any of these things. I respect that too. You are autonomous. You know what works best for your body, and that's going to change as you age. If you would ask me 3, 4 years ago about GLPs, I would have said absolutely not. So I do think that that part needs to be part of the conversation, is that even if they are an amazing tool, that doesn't mean that you have to do them. It doesn't mean that there aren't other options. We have things like metformin. If you have genetically high or diet and lifestyle is raised that A1C, metformin has been around for decades. We have a peptide called AOD. It helps with fat loss. And so it doesn't have the same appetite effects. Excuse me, it doesn't have the same appetite effects as the GLPs. So some people will do that one. There's also those growth hormone peptides. They're not growth hormones themselves in the way that GLP medications stimulate GLP release. Growth hormone peptides stimulate growth hormone production and growth hormone release. So for some people, those work really well. It helps them gain muscle. It helps them lose body fat, especially as we age. For both men and women, those are excellent peptide options if GLPs are not for you or if you have side effects on them. We also have a peptide called MOTS-c. MOTS-c, really great at mitochondrial, really great at energy and hormone regulation, also helps burn body fat. MOTS and growth hormones don't work quite as fast as the GLPs, but they don't have the same GI side effects. So for some people, those are places where they want to go. And then people ask me about hormone therapy. I have that 2 slides next, but hormone therapy sometimes helps with that weight loss too. If a GLP is not for you.
Yeah.
Compounded versus name brand is a big question.
We definitely want Leo on Prime this season.
Hold on.
Hello? Am I interrupting her?
Yeah, do you mind muting?
Yeah, sorry.
No problem. I couldn't find my mouse.
No.
Okay. Compounded versus name brand medications. I don't want you to think I'll just mute everything. If everyone could just mute, that would be great. I think I got everyone. Okay. Compounded versus name brand medications. It's like Tylenol. A lot of us take acetaminophen, not Tylenol. There are a few cases where we've had name brand medications work best. NP thyroid is one of them, if anybody was around. It's sort of the height of Hashis right around COVID. There was some problems with the generic version of NP thyroid. It didn't work quite as well. The data with the GLPs is essentially that name brand works just as well as compounded medications. The biggest thing with compounded medications is you need to know your pharmacy. This is where we go back to research grade. I am not a fan of research grade pharmaceuticals. If it is coming in a powder and you are mixing it, it is a research grade. Which means it is not intended for human use. A lot of people are using them. My personal opinion is that's not a great idea. But outside of that, if you're getting it from your pharmacy, they're great. I think for a lot of people, they're a better fit. They're much lower in cost. But also you have the vial and you can draw yourself, which allows people to adjust their dose. A lot of times people need to come in on a lower dose, especially for those first 2 or 3 weeks. And you can't do that if you're getting the name brand because the name brand comes in an injectable pen that you inject yourself. So you have no control over the dose versus it coming in the vial. Also, tirzepatide is compounded with typically B vitamins. That's the most common one we see. And that's because B vitamins help with energy. But it is also compounded with glycine, sometimes also with taurine. We have it with glycine, which I am a big fan of. And that's because some women don't do well with B vitamins. If you have the MTHFR gene, You don't process B vitamins well, so having it in your tirzepatide is not advantageous to you, and glycine helps with sleep and muscle. I've also seen people on their labs when they've been on tirzepatide for a couple years or a long time, and they've come to me have really high blood levels of B vitamins. So sometimes it's a good idea to find a tirzepatide that's not bound with B vitamins and just take those B vitamins yourself, so that you can get the methylated version. Anything compounded that's a tirzepatide is going to contain a B vitamin. It's how they get around the patent. So we'll always see it. Retatrutide is not compounded with other things. And then hormone therapy and GLP. This comment right here just got me removed from the biggest menopause Facebook group. Oh, they work with Ellie, which is a MLM, and someone asked about HRT. If you are on HRT and you add a GLP, it might impact your hormone therapy. You might need to change your dose, and the reverse is also true. And the action there is because fat cells basically produce or convert estrogen. So they convert your testosterone to estrogen. This is true in both men and women. So if you go on a GLP and you lose body fat, you're going to change the ratio of estrogen to testosterone in your body. This is really great for men. And this is one place where men and women are different in how they process GLPs. A man goes on a GLP, he loses a lot of body fat, his testosterone is going to go up, and he's going to feel great. A woman goes on a GLP, she loses a lot of body fat, her estrogen, which is already plummeting, might plummet worse. So that's where we want to monitor what you're doing, and we want to make sure that whoever you're working with understands women's hormones in addition to your GLP, because they work together. Doesn't mean it's bad. Actually, we see in data that people on a GLP and hormone therapy tend to feel better and lose more weight. So it's not a one or the other. They are not contraindicated. It's just that your fat tissue, it converts estrogen. So that's exactly how that mechanism works. And so we want to understand that. And so that's a common thing for people to have happen. They will be on a GLP for quite a while. They'll add hormone therapy, they'll see a change, or usually it's the other way. They're on hormone therapy, they add GLP, and it impacts their hormones. One of the questions was about hormone therapy. Actually, two of the questions were about hormone therapy instead of GLPs for weight loss.
Woman accused of seducing a teenage boy.
This is my fault for not putting everyone to mute when they started. Sorry. Hormone therapy itself is not associated with weight loss. Sometimes it can be associated with weight gain, but I have seen it also cause weight loss. It really depends on what's going on with the person. If you are achy, a lot of women don't even realize that their shoulders, a lot of men too, but a lot of women don't realize that their shoulder pain, their elbow pain is actually their hormones. And so what happens is they go on hormone therapy, they feel better, they can exercise better, right? So maybe they were playing golf, or maybe they were playing tennis, or maybe they were lifting weights and they stopped pressing overhead because of that pain. Then they went on hormone therapy and they were able to exercise. It also helps, hormone therapy also helps with your gut and the regulation of your gut. And then testosterone, which is the hormone therapy for men, but also women. Testosterone helps with muscle. So when you have testosterone, it is easier to maintain your body muscle or gain muscle. And when you have more muscle, you have a higher metabolism. So you burn more calories at rest. So those mechanisms are the primary way that hormone therapy causes weight loss. By itself, it doesn't really, but people do tend to feel better. And if they're taking testosterone, certainly they will see more muscle and usually fat loss too. Occasionally, hormone therapy does cause weight gain. Occasionally, but that's usually because people aren't watching the hormones and they're letting the estrogen get a little too high. Okay, why did GLPs fail alone? If you've been on my social media recently, you have seen this study, and this is the thing that I think should be shouted from the rooftops. 2/3 of the weight lost is gained back when people stop if they don't come up with a plan while they're on it. And actually, 1 in 5 people will gain more. That's a really important side effect. Primarily with Ozempic and Wegovy, but it's also happening with tirzepatide and Retta. The primary reason here is not because of the medication. And so the medication's getting, and really we should say peptide, but everyone calls it a medication. The primary reason is not the medication. The primary reason is the way that the providers are handing out the medication. It is just getting shipped to your door. Like they're just sending a GLP to your door, sending you on your way. And that is the reason why the weight is getting gained right back and sometimes worse. And the reason that it's worse is because of the way that you lost the muscle. So when you have the weight gain or the weight loss, if you are not eating properly, if you are not strength training with that, you will lose body, you will lose muscle. When you see people go on Ozempic and they lose 40 pounds in 2-3 months, there's no way you're not losing muscle with that. And the studies show between 15% muscle to as high as 50% muscle. And that is entirely related to how you are behaving when you are on these medications and how they are monitored. I personally think it should be like essentially illegal to just hand someone a GLP. Because if you put them, especially the ones that are at a higher dose, if you put them at one of those high dose GLPs and you don't eat anything and you lose a whole bunch of weight, and you're not eating protein or strength training, you're going to lose muscle. And when you lose that muscle, you've lost your metabolism. As a woman, you've also lost your survivability of all cancers and your fall risk. So actually your life expectancy can go down in long term if you take these medications without any oversight. Which is happening a lot, unfortunately. And when we see like, where can I get this the cheapest? It kind of makes me just go, yeah, but that's really not what you want because we don't want to just take something without any oversight, especially Ozempic and Wegovy, because I don't want to harp on those, but because that one is usually used at a higher dose, it usually causes that weight loss initially a little bit faster because people get a little bit nauseous on it, and so they don't eat. We want to make sure that we are eating. We want to make sure that we are hydrating. We want to make sure that we are feeling well. Most of the side effects associated with the GLPs are coming from the care. So the nausea is coming from how you're eating, what you're eating, if you're drinking enough water. And that's where people aren't getting the kind of support they need. And I hope that like if there's one takeaway from it, people get that they're extremely valuable tools. They're absolutely helping people, but they're also extremely powerful tools. And so it's really important that we're using them with people that understand how to use them for long-term success. And then here are same thing, muscle and hormonal shifts. This is, I kind of talked about it in the last slide, but when you lose weight too quickly, already what's going on after 35, which is true for men and women, we're losing muscle mass every year, about 1%. Our thyroid gets a little sluggish, our gut gets a little bit inflamed. We have this cortisol issue from stress or from not sleeping well a lot of times in women. And so our hormones themselves are impacted. And so if you add to that not eating, and not exercising, not strength training, not having protein, you create kind of a problem without a foundation. So really important to basically build the whole strategy together. And that's how you are going to be the healthiest version of yourself and make sure that the version of you that loses weight, loses body fat, not just scale weight, and ends up in a healthy place where you can stay. Still, I want you to remember that it's not a willpower thing. We really look at GLPs. I hear it every day, like, oh, you should just get some willpower. Like no woman has ever tried that, right? Like no person that's ever lost weight has ever just thought like, if I wanted this more, it would happen. It's not that. It is that there is tools that we need and we have the tools, but they have to be done with the right strategy. And this is kind of this is exactly what my strategy looks like, how I do it and how I think everyone should do it. I think it should always start with lab work. We always want to look at what is going on in the body. Rule out, is it a thyroid problem? Is it a testosterone problem? Is it, is there inflammation going on? What does the CRP look like? We want to look at where are the labs. That's always the first place to start. Make sure everything is healthy before we add on to that. If something else is going on in the background, losing weight is not going to fix it. It also gives us insight into when we're losing weight. Do we need to take into account the autoimmune condition? Do we need to take into account where the hormones are? Do we need to make sure we watch that estrogen as we're losing weight because it's already low? And that's why it's a targeted medication. We're not just blanket throwing at really high doses. That's another thing we see a lot of times when it's being prescribed, especially from some of these like online influencers. Is they're throwing people on the highest dose really quickly ramping up the dose. The GLPs are all like dose dependent cost pricing. So there's a lot of incentive to get you up to a really high dose. Most people do fine at a really low dose. Like I've seen incredible weight loss at like the first or second tier of tirzepatide. There's no reason to go to really high. So that's where we want to really be targeted. And what are we doing? Like, how do we help you lose weight at the lowest possible dose? That lowest dose is going to allow you to not have side effects, as much side effects, if any. It's going to allow you to maintain your muscle. It's also going to allow you to come off of it. That's another question I get from people. It's like, well, am I going to be on this forever? I heard a doctor on a call last week use the analogy of glasses. It's not that you have to be on glasses forever. It's just that it makes it easier. So a lot of times when people go on these medications, they're like, this just makes it easier for me. It was hard for me to manage my blood sugar. You can manage your blood sugar on your own. I work with people every day that that manage their blood sugar, that lose weight, that manage their strength. It's just a little bit harder. You want to always be eating enough protein and enough fiber, super important, which is another reason why you want to keep that dose low. If you're nauseous, like I've never heard a person be like, I'm really nauseous, I really want a chicken breast. When we're super nauseous, we reach for carbs most of the time, right? People want rice, they want toast, they want bread, they want, something that helps them with that nausea, which is not the protein that you need. So if you're at too high of a dose, or if you're not having that nutritional guidance there, or watching your own nutrition, not to say that you have to work with someone like me, that doesn't work for everyone, but if you're doing it on your own, really watching that you're getting enough protein, super important. And if you're nauseous, maybe backing back that dose a little bit, or that's where something like a Retta might come in, because people tend to be able to eat more carbs on it and still lose weight. Also, an advantage of tirzepatide, that because you process blood sugar better, you can eat a little bit more. People tend to be a little hungrier on it, especially in the beginning. People are like, it's not working, I'm still hungry. I'm like, it is working. It's just not like making you starve yourself. It's okay. You want to make sure that you're getting protein and fiber, because fiber is going to help you stay regular. Sometimes these medications can be a little bit constipating. Not always. Some people have the whole other spectrum. The gut is just a special thing. But you want to make sure you're getting enough fiber. It's just a good practice for your health anyway. Resistance training in the form of strength training is essential to maintain muscle. We can do body weight, we can do bands. At some point, we probably should pick up weights to maintain that muscle. It's going to help the appearance be better. There's always a concern about losing weight too fast. There's a thing, Ozempic face, that we're seeing, and that's from people dropping their muscle too fast or losing the collagen. When you don't eat enough protein, you're not going to make collagen. We synthesize collagen from protein. So another reason to keep the protein, another reason to keep the strength training is aesthetically, it is more, I don't want to say appealing, but the look that people don't like comes from losing muscle too fast. And that's where we hear skinny fat, or we hear metabolically obese. Those are two things you might hear. And that's where somebody loses a lot of muscle, and then they have, problems that you would see in someone that maybe is very overweight, even though they are thin. Optimizing hormones, really important to monitor your hormones on the GLP. I think it's good practice to monitor hormones anyway. In men and in women. In women, sometimes they say, oh, they're not accurate because they fluctuate. If you catch them when they're low, right? So like they might look normal and be low, but if they're low, they're low. So good idea to pay attention to where those are in the chance that you need adjustments. And then long-term strategy. Everyone that I'm working on with a GLP, where are we going? We're not just going on this medication. Like, is the goal to lose some weight and then back off that dose? Is the goal to add the GLP and build diet and lifestyle? So you're using it in conjunction with a good diet and lifestyle plan so that you can come off the GLP, right? Because it's harder to lose weight than it is to maintain your weight. I think I say that every single day. What you have to do to lose weight is different than what you have to do to maintain. So sometimes we use the tool to help us lose weight while we have built the strategies and the habits that help us stay there so that we can come off of it. Which kind of leads to where do you go from here? If you want more information, or if you're hearing about this and going, does this apply to me? It's really hard for me to tell on a webinar. There are definitely people that I think a GLP is the right fit for. A lot of people, whether it's on a micro dose or a regular dose, whether it's tirzepatide or retatrutide, there are a lot of people that could benefit from it. But there are some people that either that's not what's for them, or there's something in their lab, something in their history, something in their hormones. And that's kind of what I go over in strategy sessions. These are totally free. They're 30 minutes. A lot of times I go over, if you've met me, I love to talk. It's truly my passion. Like I could talk about this all day. I consider myself so blessed to work with people and their health. I love to stay up to date on everything. And that's why I offer these calls. It's not a sales pitch, very similar to tonight. We go into what have you been doing? You know, what do your hormones look like? What does your autoimmune look like? What does your diet and lifestyle look like? What are your frustrations? And that helps me say, hey, yeah, I think a GLP might be something you consider, whether it's with me or someone else. Or no, I think maybe it's a hormone therapy option. Or, sometimes it's really obvious to me if it's a dieted lifestyle or autoimmune type condition. And that might be a place where you might want to look, or if there's someone that like I know it's not going to be a good fit for them to do a GLP, I can tell them that too. So it's just it's a free call, so don't feel like you're going to get on it in sales pitch. I'm not very good at sales anyway, so even if I wanted it to be. And then tonight, as a bonus and a thank you for everyone showing up, I will review labs on all those calls. So if you have labs and you want to have them reviewed, usually that's something that I charge for. Lab work interpretation, I'm certified in functional lab work. So we look not just at pass fail, we look at like the best way I can describe functionally looking at lab work is if you call your child's teacher and you say, how are you doing in math? And they go, great. That's what yes or no for conventional medicine looks like with labs. With functional labs, we go, it's a D minus. So maybe you want to look at it right now before it becomes an issue. And so usually that's something that I do either once I've brought on a client, I send them for labs, or if somebody just wants a lab interpretation. But for everyone that comes to this, I will do that for free. So we can either send your labs in or you can send them over to me and I will review them on that strategy call for free, which helps you understand, hey, this is what's going on in your body. That maybe you might want to address. This is how a GLP would or wouldn't help you, or a hormone therapy with our providers, or anyone else. And this is this URL code. Look at me. Anytime I do something for technology, I'm like so excited about myself. Tell my husband, I'm like, I'm an astronaut. And now it's for questions and answered. I think I covered all the questions that I got. I did get one. Oh, I did get one I know I didn't cover. Was about, is it okay for, I've had several people actually where it's been them and their daughter or them and their sister, them and their son, where it's two people and would it be okay for both of us? Which goes back to the same of probably, but I don't know. We need to look at what's going on with hormones. Women in their, early 20s, sometimes it's like a PCOS situation when we can't lose weight. And with any autoimmune condition, if we don't address the underlying issue, it can go on. We see PCOS turned into Hashimoto's thyroiditis all the time, especially in my generation, a lot. So we really would want to look at what our labs. Doesn't mean that GLP wouldn't help. A GLP will help a lot of times, but depending on your age, a GLP may or may not be the best first line of defense. We wouldn't want to miss an autoimmune condition by just considering it a weight condition. And I think that's all of them, but I will also respond to all the ones that came in email. I tried to put them in the presentation because usually they're questions. Usually if you're having that question, someone else is having it. But if you sent a question and you didn't see it in there, you can either ask it now or I will email it back. So I will open it up. You can unmute unless I muted you and you can't if you have any other questions, or you can put it in the chats. Let's see. How long will you start seeing results when using Wegovy? A couple of weeks. You should see results in a couple of weeks. Usually tirzepatide's a little bit faster because it depends. Usually tirzepatide's a little bit faster because it helps with inflammation. So I've seen people who are super inflamed like drop 6 pounds. And that is, as a person who's not a fan of super fast weight loss, in that case, it was exciting because you could tell. Like you could see the person was like inflamed all over their body. They felt inflamed. They went on it in the space of 2 weeks and lost like, you got to account for water, but 4 to 6 pounds, which is not body fat. But you do see results in those first few weeks. You also want to make sure that what's happening is not that you're so nauseous you can't eat for 2 to 3 weeks. So it should be it should just be like a quiet whisper, like, oh, I'm just noticed that I'm not as snacky. That's where we want it. And that is going to be a slower weight loss, but that's going to be a sustainable weight loss. What you don't want is I don't even care about eating. And I've seen that with Retta, where people are like, oh yeah, I just didn't care. And like 18 hours went by and I realized I hadn't eaten. Yeah, that's not great. We want to be low in our dose. How would having lipidemia affect weight loss on these peptides? Yeah, lipidemia, there's great data behind it. A lot of those type inflammatory type conditions or where people are having trouble, their body tends to respond really well to it because the peptides are coming in and they're healing. They're really changing the way that your body is processing blood sugar. They're changing the way that your body is absorbing nutrients and oxidizing that fat. And so it can be really life-changing. There's also some data with Retta with that one a little bit more. So it's a personal consideration as to whether or not which one of those would be best for you. And it would be best to look at exactly what are your labs and symptoms. But there's a lot of really promising stuff behind it with that one in particular, lipedema. Over here, it's working well. My weight is staying the same. Trying to exercise more or walk. Wait, I missed. Sure. It's okay to stay on Zepbound for over a year if it is working well. My weight is staying the same with the dose. Yes, totally fine. Yep, I've seen people on it for 2-3 years. We don't have long-term data to say long-term it's okay, but what we do have is the fact that they've been around for like 8 to 10 years. They're not new, and it's not something that is new to your body. So it's not like we're taking a pharmaceutical product where it covers a lot of things and it's doing a lot of other things. Peptides are very targeted in what they're doing. So very common for people to be on them. If you're doing well and your weight is staying the same, that's okay. If you're wanting to build back muscle, you might need to back off your tirzepatide dose just a little bit so that you're a little bit hungrier, or think about something like, I thought I put it in here, the CGC IPA. Let me see. There's a few, let's see. It was under other options. I might have deleted it. Let's see. There are a few other options. Here we go. Did I put them in here? No. That would have been helpful. Oh yeah, I did. So there's a few options like CGC, IPA, ipamorelin, samorelin. Those are peptides. So what a peptide is that you can't do hormones. Yeah. What a peptide is a peptide is a signal. A peptide is telling your body to release something that it either genetically doesn't make enough of because of your age, it doesn't make enough of, because of your gut health, it doesn't make enough of. So peptides, all peptides, and GLPs are peptides, all peptides tell your body to release something it was already releasing. So we have a class of hormone peptides. But yeah, the growth hormones, if you don't have a clearance from your oncologist, they might say no with the growth hormone peptides too. So for you, your probably best bet is going to be like a really targeted strength training, making sure you're eating enough protein. You might have to back up the tirzepatide. If it was me personally, I would probably do it in the fall, and be okay with coming up just a little bit in your weight and doing like a recomp. So you're wanting to take creatine, you're wanting to eat like 1 gram per pound of body mass in protein. So a person that weighs 150 pounds, you're wanting to get like 130. I don't know if you're in the challenge. I totally forgot to put this in the challenge, so I don't think a lot of the women that are in the challenge are on here tonight. But you want to be getting like, if you're, say, for example, if you're 175 pounds, you don't need to get 175 grams of protein. It's 1 pound per lean muscle mass. So take off like water, weight, bones. So probably somewhere in like 135 grams of protein. So making sure you're getting enough protein, having creatine, 5 grams of creatine a day for women, really great. That will help you gain back that muscle too. What other questions? Someone unmuted and then classic Holly, I didn't stop talking, so I think somebody else had a question. You're welcome. Can you tell us about the challenge? Yeah, so I did a challenge that started a week ago. You could still join. There's 2 more weeks in it, and we are talking all about how to lose weight in perimenopause without the GLPs. Not that you can't do the GLPs, but we're really focused on things like fiber, the small things throughout the day, the way that you eat, your movement, your sleep, all the pillars that add to it. Because they work synergistically together better. So when we look at weight loss, you can lose weight without things like GLPs. It's more difficult, but you absolutely can do it. But either way, it works better with these diet and lifestyle. So if you want to send me a message, you can totally, I can add you back into that. Do I have a link? Can you send me an email? I do have a link, but I don't have it. I don't have it with access on my computer right now because it's on my Facebook and I don't have my Facebook open. Yeah, you can join. Absolutely. There's still a few more weeks in it. I've been doing an email every day. And so we go over stuff in there as well. And then I can send you the back stuff. We had a packet and it had more information about it. Does anyone else have any questions? Trying to think of the most common ones. I tried to include all the most common ones. Ah, thanks, Brooke. Yes, it can be super hard to get protein and fiber. And I even find for women, a lot of women, fiber is the really difficult thing. And I think it's because we're hearing protein like everywhere we go. I saw this hysterical meme that was like, I get more pressure to eat more protein than I ever did to do drugs as a kid. And man, I was like, yeah, that's proteins in everything. You got protein chips, protein, everything. They're going to make a protein version of a salad at some point, I swear. But fiber, because we're so focused on protein, can be really difficult. And they actually just came out with a recent study, which I feel like is the trademark. I'm saying that every other minute, but that's because I like constantly am reading information. They just came out with a study that found that the grams of protein women eat in perimenopause is the biggest predictor of weight loss, not protein and not calories. It's actually fiber. And that's because fiber helps you regulate your blood sugar. And so it's working in a similar way to these GLPs. It's helping you regulate your blood sugar. It's helping you stay full. It's helping you clear excess. Oh, thank you, Sarah, for sharing. So she just shared the link to the challenge group. It's in Facebook, so you can join that if you want. I can approve it when you're done. So fiber is super important. Protein to maintain muscle, fiber to help you lose weight. How do people deal with a skin sensitivity? So do you mean to the injection site? You can unmute if you want.
No, not to the injection site, just like a result of having been on it for a while. Um, I don't know how to describe it. Just like everything kind of aches.
I haven't had anybody, I haven't had anybody deal with that.
Okay.
Is that something that, well, you don't have to answer that. You can always
Yeah,
message.
I had it when I was trying Retta a while ago.
Mm.
I guess people have
So,
like microdosing, but I don't think that really helped.
Retta, Retta is everywhere right now. Everyone talks about Reddit. It's the best thing under the sun. And I have been a little bit hesitant to jump on the Reddit train full steam. Still tend to lean towards tirzepatide because of these kinds of things. So I haven't had anybody that I've worked with have that side effect, but I have seen women have itching all over, which is kind of a similar mechanism, right? So it's like your nerves noticing something that's not really there. So I've seen some women have some itching. I've seen some women have the elevated heart rate. So you can actually see a 10 beat per minute average elevation in your heart rate on Retta, which NAD does. There's a lot of things that do that. But so my concern is with that. And so I have seen the itching. And so understanding that, and then somebody just put their skin texture is dry and a little different on Zepbound. So the primary action there is usually because your body is reducing collagen. So when your body isn't producing enough collagen, you're going to get dry skin. That's a known side effect. Dry skin and breaking hair is probably the biggest concern that people have when they come to me. So even though I haven't seen before I go on to, because I'll digress, I have not seen myself the pain, the skin pain sensitivity as a side effect. But I wouldn't be entirely shocked just because I've seen other things with Retta in terms of the way that skin feels, not just dryness, but the way that like an itching that happens. Women are predisposed to have histamine issues as our estrogen is fluctuating all over the place, especially this time of year. I work with a lot of women functionally, and we see a lot of mast cell issues right now. And so they're kind of predisposed to having that. And so Retta can actually make that worse. So collagen production also can go down. So I hope that answers it. You might see it with Retta, whereas you wouldn't see it with tirzepatide. But I haven't seen any studies related to it. I will look it up if you want. I would be happy to. I can ask. I'm in a bunch of big chats with providers and see if other people have seen it. I'd be curious if they saw it on Reddit and then anybody was willing to try tirzepatide instead, and if they didn't see it. Only because the itching and the heart rate is something we don't see on tirzepatide that we do, which is why if somebody is not like wanting to lose a lot of weight, or there's a small percentage of people that I think Retta is definitely the first go-to, but for a lot of people, tirzepatide is actually what I would lean to. I hope that kind of answers that. The skin texture. So yes, you produce less collagen. You should take collagen powder. The collagen pills are not enough. It's not enough collagen. You need to be getting like 10 grams of the micronized collagen. Vital proteins is okay. I'll be honest, right now I'm using vital proteins because 3 in the house are taking it and it's expensive for me to get the Ancient Nutrition or Alia collagen. I'm a big fan of all things holistic and eating as best as we can, but we do have like astronomical grocery bills. So if you do like an Ancient Nutrition, it is a little bit better of a product for joints, but for skin, Vital Proteins is just fine. You can take that in conjunction with vitamin C. You do want to take both together. It helps the absorption of it. It will help with that dry skin feeling that you're getting. You also want to make sure that you're getting enough fats and taking a fatty acid supplement that will help with skin. And then some women, actually, it's growing in popularity. Well, people will take they'll take GLPs in conjunction with Clo. Clo is a blend of peptides, and that helps it helps with collagen production and angiogenesis. So that helps women grow hair, so they don't get that side effect. Like if their concerns are hair drop or they're already experiencing hair drop. So you would start with like a collagen and fatty acids. And if that's not helping with the skin, you have the option of something like a Clo, which boosts your natural collagen production in the same way that this boosts your natural GLP. The GLP pill is Ozempic and Wegovy right now. So it's still an option. But are you adverse to needles?
No, not really. It was more of the way that they quote unquote market it is that it's lower dose even than the injection. Is that not true?
It is and it isn't. I haven't worked with anyone that's done the pill yet. Everyone I've done has done the injections. There's some question as to whether or not the peptides themselves are really fragile. So a lot of people have the concern as to how well it's going to hold up in the pill form. That's why you see there's a lot of places out there right now offering like oral GLPs. And the way I look at it as like a saline, right? So we go into the ocean, we're in salt water, we can't drink it. We get saline drops, we put it in our eyes, it helps with allergies. If we go to the hospital, we get an IV injection, they don't work the same. So the pill is supposed to work the same in terms of weight loss, but we're not really sure if it's going to in terms of inflammation. So that would be my reason to think that the injectable form would be a little bit better, is that inflammation and cholesterol piece. But you can take it for any amount of weight loss. I mean, I've seen people go on tirzepatide for the last 10 pounds, a lot of women actually. And it used to be considered, oh, that's the vanity pounds that they're wanting to lose it. No, those people are usually people who have been trying for the last 5 years and cannot reduce their inflammation. And so they're going on it for the last 10 pounds. So reasonable to do it. I'm just not as on board with the pill version of it. They say there's going to be a pill version of tirzepatide this year. It was supposed to be coming out this summer. The only holdup is whether or not it's going to, whether or not the fragility of the peptide is going to hold up to the pill process, and if it would hold up in your stomach acid, right? So yeah, when you inject it, you're bypassing the liver. So most of the pill versions are just working on appetite control, so not so much inflammation.
Okay, yeah, and I mean, you know me well enough. I don't have 100 pounds to lose. Like for me, it is truly about, like you said, inflammation, bloat. I'm doing the things, weight's going up regardless of anything I do. Now, mind you, had some medical issues recently that have prevented me from continuing on to do some things, but trying to get that back on track. But you get the point. I don't have 100 pounds to lose. I have 20 to 25 pounds to lose. It's like a never ending battle. We all I know everyone on this call probably feels that way. So,
Yeah,
okay.
it's really hard. I mean, I've been working with women really closely for perimenopause space for years
Yep.
and years and years, and watch it just like, I mean, the ability to lose fat. The Dr. Bill Campbell, I just was on a call with him last week, and he's so excited because he has this study from Florida State where he got women in perimenopause to lose 5 pounds. And his whole thing has been don't do extreme diets, and that perimenopause women, calories in, calories out. Like that's his whole soapbox that he's been on for years. And so he's out of Florida State, and he's finally got this study that shows how he was able to get women in perimenopause to lose 5 pounds. Women who were already exercising, already eating well, to lose 5 pounds and keep it off for 6 days. And this is exactly what they did. This was their 7-day protocol. I kid you not. And he's so excited about this. They ate 400 calories a day of only protein for 4 days in a row. And for those 4 days, they walked 6 hours a day. I'm not even kidding you. And then they ate normally for 3 days. And at the end of that, they had lost 4 pounds, and they were able to keep it off even 6 weeks later. And this is so exciting to them. And I'm like, do you guys understand that that means that's what it took for you to find a study for women to lose weight in the course of a month? Like, I'm not walking for 6 hours a day for 4 days on a chicken breast. Someone will die. I will come home and my husband immediately, like, I'll be so raging hungry. That I just think sometimes it's like people really don't understand how hard it is to lose weight after 35 or 40.
Yeah. All right. Thank you. That helps.
Sure. Vitamin C in what form? I just get my vitamins usually from Thorne. I really like Thorne. I really like pure encapsulations. There's actually a website called labdoor.com that ranks all supplements because the FDA doesn't examine supplements at all. But you can look on there for rankings because there are a few supplements that you can get from like Costco and Amazon. I'm always a fan of like the least expensive. Pure encapsulations is not too bad. That's usually, I think that's who my vitamin C is. But there's a brand, Sports Research is the brand, and it's black bottle. You'll see it if you go to Costco right now, they have it. It's a great brand, and the price is really cheap at Costco. So if they have a vitamin C, I would grab their vitamin C. Their vitamin D is excellent. They have that at Costco. Vitamin C is pretty, I don't want to say like mainstream, but it's not like some of the others where you really want to look into the brand. But you definitely want to be taking it at the same time. And some Vital Proteins has vitamin C in it. This was a big thing I called out a few years ago. If you look at your vitamin C label, if you're getting it from Whole Foods, it has vitamin C in it. If you are getting it from Costco, it does not, which is pretty sneaky because the package is exactly the same. And so you want to look on the back because some versions of it do contain vitamin C. They are a better product and some do not. Not a big deal. I still get it at Costco because it's cheaper. I think I got, what is the average cost? That's sustainable. Oh yeah, the No Way to Live, that study, right? I mean, they're so excited. And this Dr. Bill Campbell, he's great, but he was talking on this call and he was like, oh yeah, I could see women doing this. Like, you shouldn't be doing it for longer than 4 days because it's going to be really bad for you. And I'm thinking, no people are doing this for longer than 40 days, 4 days. Like, nobody is getting to day 6 and going, yeah, I could keep doing this. And he's like, I could see people doing this for like once a month, every month. I don't know if you guys are different than me, but I am not eating 400 calories and walking 6 hours a day once a week every month. Like, how are people even doing that with their job? I see that being really hard. Average cost of being on a GLP, that varies tremendously. I have seen people really overcharging, especially tirzepatide and Retta. I mean, like I've seen people charging like $700, $800, $900 a month. Which I just think is unreasonable. I would say like it really depends on your dose and it really depends on who you're working with. Like I don't just do the GLP, so the GLP is a portion of it, but with everyone that's on a GLP, like we're talking, I'm giving them nutrition advice, giving them supplement advice, exercise advice. And so there, it's usually like 300, I would say, or so a month. Somewhere in there, depending on your dose, and depending on which one. Semaglutide is the least expensive by far. of the ones. Tirzepatide's a little bit more expensive. Retta is actually a very similar price to tirzepatide, but it is being charged a lot more for it because it is popular. Which maybe is something that I shouldn't say out loud, but that's my view on it. Because the actual cost of the medication is a little bit higher, but it's not that much higher, and you're seeing it really come in very high. And certainly once it comes on a name brand, I mean, I've heard people tell me that they went to their pharmacy to pick up Zepbound, and the cost was $800 a month, which is astronomical because the cost of it coming in from a compounded pharmacy is like, 250, 300, but it really depends on where you're getting it from. Me on Reddit, but I hear good things about tours. I don't recommend going back and forth. Your body gets used to the dose that you're taking of it, and you're going back and forth from the glucagon to the tirzepatide. I've not heard people doing that. While getting the food noise reduction of the TERS. Noise reduction that could have been better for me on Retta. Yeah, sorry, I was reading that. The general recommendation is not to flip back and forth between the two of them. Your body can actually, you want to protect your natural production of the medication. So you do want to sometimes take a break or go back in a lower dose, but you should restart where you were on the Retta when you take breaks off of it. So if you were at 1 milligram as the starting dose, but a lot of times people are at 0.5 or 0.25 and doing really well there. So you wouldn't want to like work your way up to 1 milligram, take 4 weeks off. You couldn't go back on 1 milligram. You'd have to go back at 0.25 or 0.5, or you can get really sick. I have 100% seen people like stop a GLP at a higher dose, which is also the risk of being on a higher dose. So one thing to know, people ask about insurance coverage. When you're on insurance, your insurance requires you to go up in dose. They require your provider to progress your dose up as you're on it. And if you are on a higher dose, or even something that's like a 7.5 or a 10 milligram dose, say like you stop for the holidays or you stop for the summer and you have it in your fridge and you just go, all right, I'm gonna go back on it. And you go back on the dose you stopped on, you will get extremely nauseous. You'll throw up, you'll get diarrhea. So that is the problem with flipping back and forth, is that you would need to stay on a really low dose of both of them. And so you wouldn't necessarily be able to go up. Well, I think you could flip from Retta to TERS, but not the other way because of the glucagon issue. People have told me they had good food noise reduction on Retta. I'm a big fan of tirzepatide. I know I'm supposed to love Retta because it's the newest thing and everyone thinks it's the greatest thing, and I've seen great results with it, but I'm just a fan of the classic tirzepatide. I've seen women do really, really well on it. And so for that reason, it tends to be one like they do tend to have a little bit less of the food noise with it. But it depends on what your experience is. I don't know why I just did a shoulder shimmy there. Like if you felt better on the TERS, go back on that. Usually we recommend people inject themselves at night. In the event that you do get some kind of nausea, you want to inject it before you go to bed. You don't need to not eat for 3 hours before. No, you can eat. It's fine. I mean, some people will say fast for an hour, like the anything that's working with growth hormones, but it's usually the ones with the B vitamins, because B vitamins by themselves can impact you, but especially if you're taking a tirzepatide that's bound with glycine. Glycine helps you sleep, so you're going to be a little sleepy, so you want to take it at night. But usually we tell people, but not Retta. Retta you need to take in the morning. So Retta is different because Retta is going to rev your heart rate a little bit, and so a lot of people feel a boost of energy, and if they take Retta before bed, they won't be able to sleep. But if it's a tirzepatide, you want to take it in the evening. They all stay on the fridge. That's a question we get. Another question we get is people are like, well, does it hurt? It does not hurt. It's a teeny tiny little insulin needle. It is not like getting a flu shot. It's a small amount of liquid, and it is a very, very small needle. And you give it sub-Q either in your stomach or your hip, somewhere like that. I've heard women give it in the back of their arm, places like that, so you really don't feel it. Is that it? Were there any other questions? I really like this. You guys had some great questions. I didn't know who was going to come because the last webinar I did, there was like 110 people registered, for it, and 3 people showed up. And then tonight there was like 160 people registered, but we got like 25 people that showed up, which is great. Because I just never know what to expect. Oh, okay. Gray market. So gray market's not inherently bad. The analogy I use is think of it like food. Okay, so if you're getting it from a pharmacy, it's like getting it from a restaurant. If you're getting a gray market, it's like getting cooking from somebody. If you know the person who is making your food, you know where they got the foods, you know how well they clean your kitchen, it's probably fine. But like, I'm not going to buy a sausage, egg, and cheese biscuit from someone that's selling it on the side of the road that tells me that they brought it in from somewhere that isn't inspected. So that's where you see the difference. The biggest thing with the gray markets to know is that right now it's eased up. There is some tier 2 coming back, but for a period of time, it was actually illegal to sell gray market peptides. So gray market, for anyone that doesn't know, refers to research grade peptides. So there are a lot of research grade peptides out there. Those are peptides that are the same chemical, supposedly. They are the same sequence, but they are not intended for human use. They are intended for research purposes only. That doesn't mean that there's bad. There's a lot of people that's had great results on research grade peptides, but it became illegal in the United States. So everything that is research grade right now is coming from overseas. And you have to mix it in your kitchen, and you have to mix it with bacteriostatic water. You don't necessarily know that you're doing that appropriately in the dose. You could throw off your dosage very easy. I also see a lot across the board of GLPs. I see a lot of places doing vials in a really big vial and telling people they're good for 4 months. They're not. All compounded medications are good for about 30 days. I've seen people stretch it to 6 weeks, maybe. But there's a lot of places prescribing one vial at a really high concentration and having people to use it over the course of 4 months. And so the problem there is a whole bunch of reasons. One, those people are usually taking like 8 units. It is really easy to go between 8 units and 10 units, and you're getting a 20% higher dose. So it is very easy for someone to take too much of it accidentally. Also, they don't have a ton of preservatives in them. So you're injecting it with a needle over and over, and it is sitting in your fridge. So over a period of time, your chances of bacterial growth after about 6 weeks become higher. Also, it degrades. So once it's exposed to air, when they're mixed and sealed, they're good for 6 months. But once it's exposed to air, the guidelines on all compounded medications are that they remain, the efficacy is the same after 30 days, but after that, it starts to decline. So that's an important thing to know too, which sometimes happens with research grade. Not necessarily bad, but everything that I use is pharmaceutical grade. So that's just my personal preference. It's an FDA certified pharmacy. It is in the United States. And so it goes through those same background checks. It's already mixed together when you get it. So there's no messing it up. A lot of times the stuff that's coming in research grade is not as effective. It has impurities in it, and so it's not as effective. The pre-filled injections, I was under the impression that they all had to be stored in the fridge. You could look at your data. Can you guys see me, by the way? Are you just looking at the slideshow? I totally forgot that this was on. I guess I could have done this. See if that helps. I was under the impression that all of them needed to stay in the refrigerator. Everyone I've ever seen that has the pre-filled injections has had them in the fridge. So I would look at the manufacturer's guidance. It's the same as your other biologics, your things like Humira. They're really fragile, and so they need to stay in the fridge. The compounded medications definitely do. You bruise from the shots even in your stomach. Have you ever checked your labs? Do you have an issue with iron? Or are you taking too much vitamin K, having a lot of green vegetables? Like, do you bleed easy? So that can be a reason. Bruising can be an iron deficiency. So there can be nutritional deficiencies if you bruise in general. Sometimes women react to it. They react to it. They get like a little tiny welt or a red spot or an itchy spot. It happens more with the other peptides and with Retta more than the other two. That's a histamine reaction, which happens in women. So we have them take quercetin. or quercetin, depending on who pronounces it. Um, yeah, so that could be the reason why you're bruising. It could be an iron issue. So sometimes that will help if you're really hydrated. Yeah, make sure you're getting enough electrolytes. You could try if you do it anywhere. Have you ever done it in your hip? Like on your back? You guys can't even see me, but like on your butt, on your upper butt area. Sometimes that will work a little bit better if you're giving it slowly. You can let that syringe come out to room temperature for about 10 to 15 minutes. Sometimes if it's not as cold, your body doesn't react to it the same. And sometimes the compounded medications are a little bit easier to not bruise because you don't have to push as hard. The vet button started to get kind of raw. Yeah, we've had people give it in their hip and been fine, especially when people have lost a lot of weight. We'll have them move to their hip because they don't have as much sub-Q tissue in their stomach area, and so they need more area to give it and have it absorbed properly. It's starting to get kind of raw. Yeah, try another area, look at your labs, make sure that you're taking appropriate supplements because you shouldn't really be bruising from it. That's not not well, I don't want to say it's common, but it's not really normal. A lot of times the supplements will help with it. I have to stay in the fridge. I'm trying to read through and see if there's any else I missed. Does anyone else have any others? Legit source, me. There's a lot of pharmaceutical grade Retta out there. You probably will get Retta results. I've seen it with BPC 157. I've seen a lot of people come in that I've seen a lot of people come in that are like, oh yeah, I tried Glow and it didn't do anything, or I've tried BPC and it didn't do anything. And then I'm like, well, did you mix it yourself? And every single time they go, yeah. And I'm like, well, yeah, because you didn't get the product. It happens with supplements too. I recently read that on Amazon, 70% of supplements they tested were counterfeit, which I found pretty amazing. Like it looks like a Thorne bottle, but it isn't a Thorne vitamin inside of it. And that's happening with Amazon and coming to our door. So I gotta think it's happening with the research grade peptides too. I'm sure I missed a lot. Yeah, you can watch the recording. We've already gone. I see, I always go over it, but that's good. We always want to give people more information. You start in 2 weeks. Yeah, good for you. Keep me posted. Let me know how it's going. Start a peptide or a GLP. You should not be breastfeeding while you're taking them. So you definitely want to be past breastfeeding. Hormone regulation is also a concern there. So I would want to know how well your periods are, if they've come back, if they're pretty regular, because hormones can be impacted for 9 to 12 months after postpartum. So we'd want to see where your hormones are. It's safe to start at 3 months as long as you are not breastfeeding. So 3 months out, but you could wait 6 to 9. It really depends on your personal situation. So like what side effects are you having? What's your diet and lifestyle? What is going on in your life? How does it make you feel? Like for some people, if you're really struggling with your weight, that can affect your mental health, right? And so if your mental health is not good, then it's like, then maybe we need to consider it earlier rather than later, rather than applying an arbitrary line, we need to look at the whole person. Your doctor recommended Manjaro. Yeah, Manjaro and Zepbound are great. I think that's probably the most, well, I'm not sure. I have to look at the data on if it's the most common. I think that it is the most favored right now. Retta is great. I don't need to rag on Retta because I do think that it is an excellent product, a great tool, but I just think that sometimes we're not looking at any potential side effects when we have something new come out. And so we have to look at those too. But Manjaro, you'll probably do great on Manjaro. I've seen a lot of people switch too from Ozempic to Manjaro, or from Ozempic, Wegovy, from semaglutide and onto tirzepatide, or from tirzepatide onto Retta because they've plateaued. And then they do really well. They get used to one thing and then they switch off. You're so welcome. Thank you for joining. I'm glad that we got you on here. Does anyone else have any other questions? I think I covered everything. We covered a lot. When into fall. You're welcome. If you have any questions about anything, feel free to send me a message. You can send me an email. You can find me on Instagram. If you want to set up a call, you can schedule one of those calls on my website, or there's a link in the recording that will come out. You can just click on there and schedule that directly if you're interested. If you have lab work, send it to me in advance. Like I said, anyone that's on the call, I will review your lab work for you. So if you're curious, hey, this is my labs. Do you think that I might benefit because of my GLP or my A1C or something like that, I'd be happy to give it to you. Or if it's something where it's like, oh, I think it's your hormones, I think you should consider HRT first. Because if someone's looking to lose weight, but if they're looking to lose weight, but their primary condition is their joints suck, their sleep sucks, and they're having problems with that, then maybe start with HRT. If your primary concern is losing weight, and then maybe those other things are good, maybe you start with the GLP. So it's a lot of understanding where is the person in terms of symptoms and what do their labs look like. What labs do I recommend to start? Sure, you're very welcome. I really like, sure. I really like a CBC chem profile. That's kind of your standard A1C and cholesterol profile for sure. CRP is something that we look at for inflammation, and then women's hormones. So estrogen, progesterone, free and total testosterone. I went kind of quick there, but that would be kind of your baseline where you would want to start. The requirements are just the CBC chem profile, really, but we want to look at where's your cholesterol. We want to look at cholesterol actually because likely your cholesterol is going to improve. And so it's great to see it, right? It's great to see, hey, my cholesterol was bad. I went on this medication for 3 months and improved. So that's a good thing to look at. A1C, same kind of thing. We do want to look at hormones just to see where you are, because if you are already low in estrogen, we want to keep an eye on that because your estrogen might get lower. And so the last thing we want to do is put you on it, you lose some weight, you start feeling great, and then you start getting joint pain and we don't know why. If we know that your estrogen is already borderline low, then we know it's something but we want to watch and keep an eye on. And that would be where I would start with that. But you can send me an email and I can send you that. I can let you know if what you have is sufficient or if there's other things that maybe you might want to consider looking at. I'm always happy to answer questions. People reach out to me all the time. So feel free to send me however you want. You can get me on Facebook, Instagram, email, or in the group. If you join the group, you can ask in the group too, because usually somebody else has the same question. So thank you so much, everyone, for coming. I know we went way over, but it really seems like we got a lot of information and I love it too much. So it was so great to talk to you guys. You're so welcome anytime. If you have any other questions, just reach out to me. And hopefully if you're interested next month, I'll be doing all the other peptides. So I'm going to dive into those. I just wanted to give GLPs their own special night because they really deserve that. A lot of information. Good night, everyone. Thank you so much.